You won't believe what happened when Shay Johnson rushed her daughter to the hospital. Doctors missed the warning signs, gave the wrong treatment, and left a 3-year-old in danger. Today, we're breaking down every shocking detail, the mistakes that almost cost her child's health, and Shay's fight to make sure the truth is heard. Hey everyone, welcome back to the channel. Today's story is one that every parent, and honestly, anyone who cares about children, needs to hear. Shay Johnson recently went through a terrifying experience when her young daughter, Shajiyah, started showing unusual symptoms. What should have been a simple visit to the hospital turned into a nightmare as doctors struggled to diagnose her correctly. In this video, we're going to take you step by step through what happened, from the first signs that something was wrong, to the mistakes made in the emergency room, and Shay's fight to get the right care for her daughter. You'll hear the shocking truth about medical errors, parental intuition, and how one mom refused to back down until her child was properly treated. By the end of this video, you'll know exactly why Shay's story has gone viral and why it's sparking a conversation about parental instincts versus medical oversight. Make sure you watch closely, because some of the details you're about to hear are truly alarming. It all started when Shay noticed something wasn't right with her daughter, Shajiyah. At just 3 years old, Shajiyah had been unusually quiet and lethargic for several days. She wasn't eating or drinking properly, barely using the bathroom, and often just lay on the couch with droopy eyes, seeming almost distant. For any parent, these are immediate red flags. Shay's mom, who is known for being very protective, noticed it too and insisted that they go to the emergency room. When they arrived, the hope was simple: get answers, find out what was wrong, and make sure Shajiyah was okay. But what happened next was shocking. According to Shay, the first hospital visit was frustrating and alarming. The doctors performed a quick check, looked at her daughter, and immediately diagnosed an ear infection. They prescribed antibiotics like amoxicillin and sent them home, seemingly confident in their conclusion. But Shay's instincts, backed by her mother's observations, screamed otherwise. Shajiyah wasn't acting like she had a minor ear infection. She was lethargic, irritable, and her body was showing signs of dehydration. She was sleeping far too much, her temperature was rising, and she wasn't responding normally to her surroundings. Shay even noticed that the doctors hadn't tested for anything beyond the ear, like the flu or pneumonia, which could have been far more serious. The first visit ended with Shay feeling powerless and frustrated. She watched her little girl continue to struggle, knowing in her gut that something bigger was going on. She refused to accept the rushed diagnosis and knew they couldn't just leave it there. But Shay's fight was only beginning, and the next day she would take a bold step to ensure her daughter received the care she desperately needed. The next day, Shay knew she couldn't wait any longer. Her mother's instincts had been correct. Shajiyah wasn't just tired or a little under the weather. She was still lethargic, barely eating, and her body temperature was rising dangerously. Determined to get answers, Shay decided to take Shajiyah back to the hospital, this time refusing to leave until someone gave them a clear explanation. When they arrived, things immediately felt different. The medical staff now took Shay's concerns seriously. The doctors quickly noticed that Shajiyah was dehydrated, her skin dry, and her energy almost non-existent. Unlike the previous visit, they performed a much more thorough examination. This included checking her vital signs, reviewing her symptoms more closely, and finally acknowledging that what they had dismissed as an ear infection might not be the issue at all. Shay described the scene as both terrifying and validating. The second hospital staff couldn't see any signs of an ear infection. They realized that the fluid in her ears, something the first hospital had misinterpreted, wasn't the problem. They also recognized that her high fever and lethargy pointed to something systemic, possibly a severe type of flu or another viral infection. This was the moment Shay had feared yet hoped for, the recognition that her concerns were legitimate. Because of Shajiyah's dehydration, the doctors decided to start an IV to give her fluids immediately. They also prepared to run blood tests to determine the root cause of her illness. Shay watched as her baby received care that should have been administered from the very first visit, feeling both relief and frustration. Relief that her daughter was finally getting the right attention, and frustration at how easily the first hospital had misjudged her condition. Throughout this ordeal, Shay remained steadfast. She refused to accept half measures or guesses. She insisted on answers, and she made it clear that she wouldn't leave until Shajiyah was stable and properly diagnosed. Her intuition, backed by a mother's love and vigilance, had forced the medical team to take a closer look. ultimately saving her daughter from further complications. But even after this breakthrough, the situation wasn't over. The doctor still needed to determine exactly what was causing Shajiyah's high fever and lack of energy. And Shay knew that the hours ahead could be critical in understanding the full scope of her daughter's condition. As Shay watched her daughter hooked up to an IV, lying quietly in the hospital bed, the emotional weight of the past 48 hours hit her like a wave. Any parent who has ever seen their child suffering knows that helpless, gut-wrenching feeling. Your heart races, your stomach twists, and every instinct screams that something is wrong. For Shay, this was compounded by frustration and anger. She couldn't shake the memory of the previous hospital visit, where her concerns were dismissed, her daughter sent home with the wrong medication, and a potentially serious illness overlooked. Shay spoke openly about the battle between parental intuition and medical authority. She stressed that, as a parent, she doesn't claim to know everything about medicine, but she knows her child. She knows when something is off. And in this case, her gut instincts, along with her mother's careful observations, were right. This wasn't just about Shajiyah being sleepy or moody. This was about her health being at risk and doctors failing to properly investigate the symptoms. The emotional toll extended beyond frustration. Shay described sleepless nights worrying about Shajiyah, balancing her responsibilities, and trying to stay calm while ensuring her daughter received proper care. She recounted how she kept checking Shajiyah's temperature throughout the night, seeing it rise from 100.2 degrees to 102 degrees, and knowing that waiting any longer could make matters worse. Every parent watching this would recognize the fear in her voice, the anxiety of wondering whether medical mistakes could put your child in danger. At the heart of Shay's story is a larger conversation, the clash between instinct and protocol. In many hospitals, doctors rely on standard procedures and rapid assessments to make decisions. Sometimes this works perfectly, but in cases like Shay's, it fails. And it's the parent's vigilance that prevents a misdiagnosis from causing harm. Shay's insistence on a second hospital visit forced the medical staff to listen, reevaluate, and act correctly. Her persistence is a powerful reminder that parental advocacy is not just important, it can be life-saving. And yet, even in the midst of fear and frustration, Shay's love for Shajiyah shone through. She comforted her daughter, held her hand, and spoke to her softly, trying to calm her little girl while navigating her own storm of emotions. It was a raw, real, and human moment, one that resonated with anyone who has ever faced the terrifying uncertainty of a child's illness. But the tension didn't end there. Even after getting proper medical attention, Shay knew the real test was still ahead, discovering exactly what illness had caused her daughter's alarming symptoms and ensuring she made a full recovery. The uncertainty kept the family on edge, proving that the road to clarity and relief is rarely simple in situations like this. After hours of careful examination, blood tests, and close observation, the doctors finally began piecing together what was happening with Shajiyah. Initially, they suspected a severe flu, but the type of virus was unusual, explaining why Shajiyah's symptoms didn't match a typical case. Her high fever, dehydration, and extreme lethargy suggested that this wasn't a simple illness that could be treated with over-the-counter medication or a routine prescription. The medical team explained to Shay that young children, especially toddlers, can decompensate quickly when dealing with severe viral infections. And early intervention was critical. The treatment plan involved multiple steps. First, they started Shajiyah on intravenous fluids to combat dehydration and stabilize her body. This alone made a noticeable difference in her energy levels over the next few hours. Shay watched intently as the nurses carefully monitored her daughter, checking vitals and adjusting the IV to ensure she was receiving the right amount of fluids. The doctors emphasized that hydration is essential in cases of severe flu or viral infection in young children, because dehydration can lead to dangerous complications, including kidney issues and seizures. Next, they planned a course of medications targeted specifically at controlling the fever and managing discomfort. Unlike the previous visit, where Shajiyah had been sent home with antibiotics for an ear infection she didn't have, this time the treatment was personalized and based on test results. The doctors explained each step to Shay, answering her questions and ensuring she felt confident in the care being administered. Shay expressed relief that this hospital was taking her concerns seriously, validating her gut instincts. The doctors also emphasized observation and rest. Shajiyah needed to stay in the hospital until her symptoms stabilized and her body could fight off the infection safely. This meant Shay would be spending the night, or possibly several nights, by her daughter's side. It was exhausting, both physically and emotionally, but Shay didn't complain. She knew that advocating for her daughter's health was more important than her own comfort. One of the most important lessons Shay shared from this experience was the critical importance of parental vigilance. Even when medical professionals are well-trained, they can make mistakes or overlook subtle symptoms. Shay's insistence on a second opinion and her refusal to accept a rushed diagnosis likely prevented further complications. It was a reminder that parents must trust their instincts, ask questions, and, if necessary, push for additional testing and care. As Shajiyah began to receive proper treatment, Shay allowed herself a moment of relief, though she remained cautious. The road to recovery was still uncertain, and the next 24 hours would be crucial. Would her daughter respond to the treatment? Would the fever break? And most importantly, what could Shay do to ensure Shajiyah returned to her happy, energetic self? These questions hung in the air, keeping the tension high and the story gripping.